Welcome back to Great Day Medical Monday. Like breathing, this is something we all have to do. It's essential to life, but many people don't do it well. I'm talking about sleep. If you have sleep apnea, you might have a CPAP machine to help stop snoring and get a better night's sleep. But studies show over half of people stop using it because it's too bulky. They don't like the maintenance. And let's face it, it's not the sexiest bedtime look right there. Our next guest has another option that's small, effective, and comfortable. He actually uses it himself. Dr. Schleicher with Sleep Houston specializes in sleep dentistry. He joins us with patient Corey Whitley, who woke up tired all the time, but not anymore. Good morning.
Morning.
All right. A lot of people have never heard of sleep dentistry, but it's an extra field of study that you took on years ago.
That's right. All I do now, I don't do any more general dentistry. All I treat is patients that have sleep breathing disorders during the night, and we correct that. So I've gone from doing hundreds of different procedures to one basic procedure, and we've just gotten so busy over the last couple years. It's been very gratifying. So I don't do any dentistry anymore.
Yeah, there was a big study that was done several years ago, and they said, what do you want more of? And most people say, oh, people want more money, right? Or they want more, they're like, more sleep. Just more sleep, and no matter what they try to do, can't get it because they're not getting to the root cause again, or how to deal with that. Okay, so you were patient zero yourself. You had that issue where you weren't quite sure what was going on during the night, but your wife told you.
Yes, my wife, actually I was banished from the bedroom because of the obnoxious snoring that I was doing. So after spending 2 years in the guest bedroom, I started to experiment with these appliances that had just come out, and sure enough, it fixed my snoring. I did not know at the time that I was suffering from obstructive sleep apnea. 20 years ago, it wasn't on everybody's radar like it is now. And so it turned out that I had moderate to severe obstructive sleep apnea, so the appliance that I wear every night fixes my sleep apnea instead of having to use CPAP mask.
Yeah, we're gonna get to that in a second, but the signs that you have bad sleep if you don't have somebody in the room to tell you.
It would be waking up in the morning, and you wake up and you look at the clock and you go, wow, it says I slept 8 hours, but I'm ready to hit that snooze button.
Yeah.
But you can't. You have to get on with your life. We've got stuff. We've got responsibilities we've got to get to. So you just bowl through it, and you end up just going through the day. I have 3 cups of coffee by 10 o'clock, and by the afternoon you're fading. Those are just some of the symptoms. Headaches, but it also leads to increased risk for heart attack, stroke, Alzheimer's, dementia.
Why sleep is so important, because it's your body's chance to repair,
so
right?
It's not so much sleep as it is oxygen. And so what happens, if you are not getting oxygen while you're sleeping because your airway is collapsing, that's the problem, and that affects your sleep. So lack of oxygen while you sleep is what brings on all these symptoms.
Yeah.
Without the oxygen, nothing in our body can work properly.
All right, while you were mentioning all those symptoms that you're not getting a good night's sleep, Corey was like, you're like nodding your head, you're nodding your whole body, because that sounded like you. What were you going through, and when did it come to your attention that you're really not sleeping through the night?
Well, it was brought to me by a loved one that I had stopped breathing in my sleep. And I did that several times throughout the night. And I would wake up, I felt like I ran a marathon, was sweating and just no focus throughout the day and falling asleep during the day, things like that.
Yeah, Dr. Schleicher, when he says would stop breathing several times during the night, sleep apnea can also be deadly.
Oh yes, there's no doubt. You pick up, turn on the news and you see so-and-so died in their sleep of natural causes. Well, many times it was related to obstructive sleep apnea. It was undetected and they died of a heart attack or a stroke in their sleep.
Yeah.
So yes, it's directly related to stroke, heart attack, dementia, depression. Just about every malady that you can think of has some kind of root cause based in sleep and lack of oxygen during the day.
Yeah. All right. You saw Dr. Schleicher, and you're a Dayton man. You're a handsome young man there, and so you had a choice between doing the oral device that we're talking about and the CPAP machine. When you see the CPAP machine, I'm just going to say, I can see why a lot of people say, okay, this is not working for me, right? So.
Now you can sleep with this.
Right.
Imagine being tethered to this every night, which is why the compliance is so low. People just can't tolerate it.
Yeah, it can work, but the problem is if you're not going to use it, it doesn't work at all, right?
Correct.
Okay, so tell us about the oral device here. Show us.
The oral device, and I've been wearing this device for about 23 years. Corey's been wearing it for
about 2 months now.
About 2 months now. But after 1 week, Corey would tell us a story, but these are very simple mechanical devices that basically open your airway naturally instead of using air pressure in a machine to blow your airway open. This little device gets your tongue, which is the culprit, out of the way. So it opens your airway naturally all night. And so instead of the mask using air pressure, we're using just a simple device
fixing the problem,
to treat a
the
very
obstruction.
complex problem. So it's a simple solution to a really complex problem.
Yeah, and let me make this very clear. I have seen some things, over-the-counter type things, or things you just get this mouthpiece. It's not a one-size-fits-all, and that's the point here. Is the reason why it's comfortable, the reason why it works. It is custom made for each patient.
Yeah, we'll take a digital scan of the patient's teeth and their mouth, and using the CT scan, get our settings. And these are super comfortable. They fit every time. We have studies that show 98% compliance wearing this 8 hours a night, 7 nights a week, as opposed to about 45% compliance with CPAP.
Yeah, I have a friend who went to go see you, and she said it was so comfortable that at some points, sometimes she forgets to take it out in the morning. And she's like, oh, I'm in my car. Oh, wait, I have that in still. All right, Corey, how did it change your sleep?
It changed my sleep dramatically. It was very easy to apply. It snaps in, and like Doctor said, it fits to your teeth.
Right.
So you don't even know you're wearing it while you're sleeping.
Yeah.
And I can attest to that. My day is very productive. I'm very focused. Of course, I do a lot of work throughout the community, and I need that. I needed that. I just didn't know how much I was missing out on.
What kind of work do you do?
I'm a Harris County Sheriff's Deputy.
Oh, yeah, of course, you're interfacing with people all the time,
So I have to be alert. I have to be focused throughout the day.
Yeah, yes. All right, so take us through the process of when someone comes in, because you obviously try to figure out exactly what is the reason for them feeling so sleepy all the time.
Well, the first thing we do is we're going to take a 3D digital scan, a CT scan of their airway, from their nose down to here, so we can see the problem. And then we're just going to do some experiments with the patient in the chair to find out if this is even going to work for them. Not everybody is a candidate. We've got to filter those folks out that we know it's not going to work on. We don't want to go down that road if it's not going to work. So maybe 5 to 10% don't qualify for this. So then we're going to take that digital scan, send it to the laboratory, produce this. Takes about 2 weeks to get it back. Patient will come back in, and we'll go through a couple of adjustments to get them just right. Then after about 3 months, basically they're going to come back in for a reevaluation. So it's not like we give this to the patient and they're done. They come back for a complete follow-up for 6 months. So that's kind of where Corey is right now.
Yeah, and because sleep is so vital to health, I want to make sure people understand this is a medical claim, not a dental claim if you're using insurance.
Yes, I'm a dentist specializing in dental sleep medicine. This is a medical claim for a medical problem, even though I'm a dentist. So this goes on patients' medical insurance. It's usually covered by most medical insurances and Medicare, so it's a well-known treatment.
All right, Dr. Schleicher, thank you very much, and thank you for what you do in terms of serving our community.
Yes, ma'am. Thank you.
All right, Sleep Houston is offering a special promotion today. If you call now, each patient will receive a flash drive with a copy of their CT scan of their airway and TMJ for $150. Okay, I'm gonna stop right here. Tell us the TMJ part and what that flash drive does.
Well, the TMJ is part of the sleep problem. Patients that are sleeping with that obstructive sleep apnea, they're going to clench their teeth, they're going to degenerate this. So probably 75% of our TMJ patients, the root cause is a collapsing airway that's causing the problem with their TMJ. So we fixes that also.
Yeah, all right. So this is a $400 medical grade image you can share with other physicians like an ENT or an internist. If you're ready to get quality sleep and get out of the guest room or off the sofa, make an appointment with Dr. Schleicher today. You can contact Sleep Houston at 713-828-8587. Again, that number is 713-828-8587. Visit their website at sleephouston.com, or you can scan the QR code that is on the screen right there, but otherwise go to sleephouston.com.